Good morning, my loves. Happy Wednesday. Difficult subject today. As many of you know, I was up the other night, all night, with a family who lost a family member. A young mother passed. And it was very hard on the entire family and devastating to her children, who are all under the age of 12. She has some little babies, and they are precious, and they are sweet, and they are confused, and they're very sad. So that's what we're talking about to kids about death and dying. So the main thing is, I know a lot of people want to protect the kids, and thank you for doing that, but do not be dismissive. Don't tell them go play. Don't say go in your room. Let them, and on a few of the conversations, let them know what happened. Truthfully, honestly, and in their language. Allow them to ask questions. Now, questions that you may find ridiculous aren't ridiculous to a child. So look at it through their lens. And this is very important to understand. These are formative years for children. You are helping them learn how to cope with grief, with loss, to understanding feelings and emotions, understanding death. That's hard enough for adults, let alone somebody that's 8. So please keep that in mind. This is going to be a core wound for a child. A death is something that they're going to carry with them forever. I mean, we've all lost pets or loved ones, and that's something that, especially if it was a traumatic death, the death of a parent, that's hard, especially for a child. So please keep that in mind. Do not fill their heads with silly stories. Don't make jokes about it to a child. That's one of the issues that the family's currently dealing with. I was speaking on the phone with someone yesterday, and my clients, as everybody knows, they are my top priority. So if we're just you and I are just chatting, and you're not a client, and my phone shows that a client is calling, I'm going to call you back because they come first, especially if it's somebody who just lost, kids that lost a parent, and we're dealing with grieving children. Top priority. And I took the call, and the person I was talking to got very angry with me because they see it as that's the family's problem, not mine. Honey, I'm a trauma therapist. I'm guiding them through this. And it really hurt this person's feelings, and I'm sorry, but they know my clients come first, especially when babies are involved. So it's about priority. So make the time to talk to kids and to help them through this, to help the families through this. It's hard. And the kids had a lot of questions. They were very confused. One didn't understand death, and that's okay. Most 3 and 4-year-olds aren't going to understand death. They may not have even had a goldfish die yet. Make the time to talk to them and explain. Don't go into gory details, but just that someone was sick and now they died. And depending on your religious beliefs, you can, bring that into the conversation. You can always bring in clergy. That's the call that I ended up being on for most of last evening. We were dealing, we had clergy there, the priest, and I talked to the family for hours because that's what we do. But don't make jokes. One of the relatives had made a very flippant comment to one of the kids, and the kids were just freaking out. Now, the adult is a bit of a reactive abuser. They're a bully, and they will say things that they think are funny. They think that they're being goofy and making the best of a bad situation. You can't do that with grief, especially around kids. Don't do that. They had scared these kids to death. It was awful. A lot of damage control. Now, did they care about what they said? Not particularly. So it was a lot of cleanup for a lot of the people that did care. And these kids were very, very traumatized. Something I'm going to suggest, and this will even work for adults, because I've had several friends who have lost spouses this last year, and I have lost a lot of family members in the last, 6 months. if somebody's having trouble, these kids, are really, they can't sleep and they're crying all the time. I said, go in to mom's closet or into the door, and I want you to get some either t-shirts or sweaters that, will have her scent, her fragrance on them. Because if you fold laundry and you put it away, it's going to still smell like mom. And get her pillow and let the kids have, a sweater. And these are little kids. Don't give them anything expensive, but give them a t-shirt of mom's that they can carry around, that they know this was mom's. And when it was nap time, let them use the pillow. You can buy new pillows. Let them have the pillow, because that will have mom's scent on it. So at bedtime last night, the kids didn't want to go to bed because of what this flippant individual had said. I said, let's do this. Let's get some t-shirts or sweaters. So one of the aunties got up and went in and said, how will this work? Perfect. And I said, oh, they had me on, we were FaceTiming. And they took me into the kids' room and, we talked about it. I said, I want you to hold this in your hands. And they did. And then they brought it, they started snuggling it. And then they started crying really hard. And that's fine. Feel whatever you feel. If you're an adult and you're grieving, feel it. Sit with it. It's fine. Your heart's breaking. It's fine. But I asked them, does holding that make you feel better? Oh, yeah. Yeah. And I said, okay. Would it feel better if the two of you shared a bed? Because they shared a room. They just had separate twin beds. And they said, oh, yeah. I said, okay. And here. And that, she brought out mom's pillow. And it was a king-size pillow that both of them could share. And that just made, that was, a turning point for them. So just go the extra mile for the kids. Talk to them. Answer their questions. Comfort them. So after the kids were down, we had a further discussion about the funeral, the services. Were the kids old enough to attend? A lot of different schools of thought on that, a lot of different family views. And, I'm not here to make decisions for anybody, and neither was the priest. We worked very well together. But, and I'm going to be very frank about this. Don't allow children to touch the deceased during a funeral, during a viewing. No, don't do that. Don't let them play with a wig. Don't let them see if, what grandma's face feels like or what mom's face feels like. Don't do that. It's disrespectful. Don't frighten them about it. I mean, if that's what you want to do it before everybody else gets there. But it's going to traumatize them, because that's the first time, in all likelihood, that they have seen a dead person. Don't scare them. Don't hold them up and say, they're viewing the body, say boo, or she's going to get you, or don't do that. And so we made sure that if the kids they hadn't decided if the kids were going to go to the funeral or not, but that they would be kept away from the very flippant family member that was causing some issues. Depending on if the child is old enough, I know, I'm trying to think, when my son was 10 or 12, our next door neighbor passed. And he was like a second grandpa to my son. And it was very, very difficult. And I asked him, and he knew that this gentleman had been sick. And I said, do you want to go to the funeral? And he said, no, I think I want to remember him in my heart the way I knew him. Perfect answer. Good job. Great. So I had a friend take him to the movies that day. And, while I was at the funeral and all that, Jeff didn't go. And that's fine. Give them the option. Let them say their goodbyes however they want to say their goodbyes. If you're having trouble dealing with your kids, reach out to me. It's not a problem. I do this all the time, but please answer their questions and be honest. You can try and prepare somebody for someone's death, you can try and prepare an adult, a spouse, a grown-up. And it's still, when it happens, it's devastating. You really can never be prepared for death. That's just how it works. I mean, I'm a retired surgical intensive care nurse. I've seen a lot of people die. In my practice now, I have a lot of cancer patients, terminal patients, chronically ill patients. During COVID, I lost 33 people. The youngest was 11 due to COVID. So I have been around a lot of death and dying. As a human being, it's sad. And yes, I will cry. When this young woman passed, yes, I cried right along with the family. And that's okay. That shows them that I'm human. It's out of respect for her. Lovely soul. And that's okay. Let your kids grieve. Cry with them. Talk to them. Share stories. It's so important to always share stories. Then at Thanksgiving, Christmas, Hanukkah, whatever you celebrate, talk to them about it. If they want to give them a present, that my nose is itching. I'm sorry. If they want to give them a present, let them get an ornament to hang on the tree that, their loved one can see from heaven. That's always a good option. There's always things you can do. Let them talk about them. Let them talk to them. Don't punish them for that. Take time for yourself to grieve. Feel whatever you're feeling. There's going to be a lot of emotions. I know the family was talking at each other instead of to each other last night. So we did some active listening, and that's when, they were saying that one person wasn't listening to what somebody else was saying. That's when, you say something and the other person will repeat. Yes, I understand I upset you because X, Y, Z. Or yes, I understand you're mad at me because, and then you state your point. Communication is key. Letting people feel whatever they're feeling is key. Loving each other, supporting each other, working together through the grief is key. And being there for those kiddos every step of the way. Love you guys.